In this segment, we're talking about the health impact the virus and the pandemic is having on our communities. So joining us now are Shawnee County Health Officer Dr. Gianfranco Pezzino and Dr. Robert Kenagy, CEO of Stormont Vail Health. Thank you both so much for taking some time tonight.
Thank you.
Glad to be here.
All right, so let's start with Dr. Kenagy. Just overall, how do you think local hospitals are doing? Do you think that they're at risk or prepared, especially because we here in Northeast Kansas and specifically at Stormont Vail take in patients from rural areas all over as well? So how does that impact the risk or preparedness?
Well, that's exactly right. So we serve a pretty large region across Northeast Kansas, and I believe we're very well positioned. We have taken all the measures to ensure that our team is safe, that our visitors are safe, that our patients are safe. And so we've had a very good response to reopening, starting back elective procedures, taking care of people with emergent conditions, just being very busy, and the safety measures that we put in place, people have responded to positively and have confidence in our ability to care for them safely. We are in a mode currently where the number of cases have begun to spike. We were at a caseload of 22 active cases in the hospital, and that was this last week where we hit that high with this last little increase. So we were able to take care of that, and we continue to be able to take care of that kind of capacity. So we're busy. The infection rate in the community sometimes makes it a challenge with our own staffing, with our own employees that may have an exposure in the community. But thus far, we've been able to safely staff, safely take care of people, provide all of the care that both emergent and elective that people have required.
Okay, Dr. Pezzino, this question comes from a viewer. Rudy Lundgren says, given the vaccines take years to develop, how far away is the medical community in developing successful, consistent treatments for COVID-19?
Well, that's really a big question. I wish I knew and I had the answer. There are a couple of drugs that are really very promising, and they are on an expedite pathway to be approved and tested, actually first tested, obviously, and then approved. But I would like to emphasize the fact that while I hope very, very strongly that those drugs are going to work, drugs alone are not going to fix our problems. We really need to find a way to contain this virus by practicing social distancing, using our mask, and just reduce the rate of transmission. At the rate of transmission we have now in our community, it's just going to be impossible to keep the virus localized to population that has a lower risk of complications, and keep the virus outside of our nursing homes, outside of our hospitals. So while drugs are really important, I think the real hope here is in the way we as a community behave to contain the transmission of the virus.
And so, Dr. Kenagy, how is the hospital participating in testing for the vaccines? I know that you were all involved in a treatment research. What's it look like for vaccine research then?
Well, you're right. So we're involved with Mayo Clinic to test the convalescent serum as a treatment for those that are sickest with COVID-19, and really some good early results from that. We have not yet been asked to be involved in testing a vaccine.
Okay, so part of Rudy's question also involved being able to get together in large groups again. I think a lot of people are ready to get back to concerts, sporting events, just fun things like that we're used to. But when will that happen? Is it just a matter of when a vaccine is ready, or is it something else like you were talking about, Dr. Pezzino?
I've tried to never lie to our community when it comes to this virus, and I don't want to sweeten the pill to a point that then I have to take the sweetener away when reality hits. So I'll be really frank. I think large gatherings remain a very high risk situation, and people should be very careful when they decide to do that. There are ways to mitigate their risk. Try to stick around family gatherings, hopefully not very large, 40, 50 people, around that number. And try to create a sort of social bubble of people outside of your family that you associate with, and they only associate with your social bubble. So the less those bubbles interact with each other, the less the risk of transmission. But in reality, this is a virus that is transmitted through direct contact with people, from person to person. And so the more people get in contact with each other in a large group, the more easy the virus will be transmitted.
So it's patience. We all just need to have some patience here.
A lot of patience, unfortunately.
Yeah.
But on the other hand, if you allow me, there is still a lot of things you can do. People shouldn't really get desperate. I had a beautiful evening yesterday. I went out to dinner with my wife. We sat outside on the patio. We had our mask when we were walking to the table, but it was a beautiful evening. It wasn't even very hot. We had a wonderful meal. So let's not just get too desperate and linked to our additional things and precautions we need to make. Let's do the things we like to do as well that we can do safely.
Yeah. Okay, so I'll have both of you answer this one as well. How does the coronavirus relate to flu deaths and hospitalizations? So why is this virus worse than the flu? Dr. Kenagy, you can start with this one.
Well, I think the death rate probably is going to be some multiple of what we see with the flu. This virus has been known and is known to be transmissible when the person transmitting the virus is asymptomatic, doesn't have these symptoms yet, doesn't know that they're sick, and so they aren't taking particular precaution about spread of the virus. So the virus is a little bit different than influenza in that regard. Of course, we don't have a vaccine right now, and we do with influenza, and we have multiple drugs that are effective to stem or to decrease the length of time that a person is sick with influenza and to mitigate the symptoms that they might have. But we don't have that yet with this virus. So they're quite a bit different, and we have a lot yet to learn about this virus. We, over the years, have accumulated quite a bit of knowledge about the influenza virus and how it mutates, how it changes, how we can alter the vaccine every year so it's hopefully as effective as possible. But we just don't have that kind of information yet about this novel coronavirus.
Dr. Pezzino, is there anything you want to add to that?
It's just a new virus. It's just a new virus. An influenza virus has been around for centuries. This is a new virus, so it's transmitted in a different way. Nobody has immunity. We have some level of immunity against the seasonal influenza virus that carries on from year to year. It's not total immunity, but it's partial. And it's a virus that's much more easily transmissible from person to person. And we have no vaccine. So when you put everything together, it's understandable why this virus is more lethal than the influenza virus.
Right. Dr. Pezzino, this question comes from a viewer. Linda Mitchell actually sent it to us over video, so here's her question.
My question is, if I have tested positive for COVID and quarantined for 14 days, and then I am later exposed to yet another person who tests positive, do I need to test or quarantine yet again? Once I've had it, am I immune from getting it again? Thank you.
That's a good question. We get that question all the time, of course. Based on the knowledge that we have today, the answer is that once you get infected and that infection is confirmed by a laboratory test, you are immune. What we don't know is, number one, how long your immunity is, if it's going to be lifetime or just for a short period of time. And number two, if it's really everybody, every single individual who gets infected will develop that immunity. We think so, and so from the practical point of view, that's the assumption under which we are working in public health. So in practice, you do not need to take any more precautions if you are exposed to somebody with the virus after you have been infected and you recover.
When will testing be widespread, or will it ever be widespread? Dr. Pezzino?
We thought we were done with our Blue Suite testing, and here we are again. It's like a deja vu what happened in March. Frankly, my answer is that we will never have a strong, solid testing system for as long as states and hospitals are left alone to struggle and fight over the same scarce resources. I think without a centralized system, and I can only think of the federal government as the entity that can manage the system, we are always going to have this kind of bumps and challenges. It's through the entire process of testing. It's from the testing kits to the transportation to the lab, to the reagents that are used in the lab, to how we report the results. It's the entire process that has so many different components that right now are disconnected from each other, and they need to be brought together under one umbrella and one responsibility.
Okay, so another viewer question tonight from Laura Blevins. I'm going to paraphrase her question a little bit because it comes from a direct situation of hers. So to make it apply to everybody, in part, she says her mom is 85 years old, is being treated for a lung infection caused by chemotherapy and lymphoma. She's been living alone, but she's tired of living alone through the pandemic since it's completely isolated her. Now, we've heard this a lot. It's a lonely virus. I've heard some elderly people even say that it might not be the virus that hurts them. It could be the loneliness of this. So is there anything that people can do to be surrounded by their older loved ones now to help them, but also do it safely? Dr. Kenagy, do you want to start with any advice on this?
Sure. Well, it's clearly a big issue for a lot of people, and not just the elderly. The social distancing has impacted us all. We're, by nature, social animals. We social people. We like to be around each other. We need to communicate. We need to, in families, you need to hug, and you just need to be around and socialize. That's a basic need we have. And so it's compounded for the elderly that are often alone or shut in, can't get out on their own. So there are some electronic means to communicate that are obviously very safe. You're not going to transmit the virus electronically. Again, some of the older folks are not able to or facile with those particular means. I think just very carefully, if there are family members or neighbors that can safely check in on people and just make sure they're doing okay. Just a simple knock on the door, just checking on you, see how you're doing, communicate from a distance. All of those little things add up to make this experience just a little bit better.
Okay, and finally, I'll have both of you answer this one. I'll have Dr. Kenagy go first. So many parts of our world have been impacted by this and are slowly getting back together in many different ways. So what does the future look like at the hospital? Where do we go from here health-wise?
So the hospital is going to be okay. I'm convinced of that. We've stockpiled the PPE we need. We've got all of the safety measures intact. I'm concerned that this political discourse that gets in the way of all of us doing what we know works. Governor Kelly mentioned a broken record. Well, the record is clear. We were able to bend that curve early in this pandemic, and we did it because we all took the warnings, the recommendations, we all took them to heart. And whether it's by order or it's just because we do what's right, we know what's right. We need to take those recommendations seriously. Wear the mask, do the social distancing, practice the hygiene, avoid the crowds. What's at stake is our ability to open schools and maintain them open over the long term. They are such an important piece of our social fabric. They support our families in so many different ways. So getting back to school is very important. Keeping our businesses open. Again, it's really important that we just take it to heart, that it's not because we're told. Set aside all of those concerns about our civil liberties and just do what we know is right. Support each other, encourage each other. Let's all do the right thing, and we'll be able to manage this virus very effectively.
Dr. Pezzino, anything to add to that about what
well,
the future will look like?
I read a quote recently, unfortunately I don't remember who wrote it. It was something along the lines of, every story has a happy ending, and if you think your story doesn't, it's because that's not the end of it. And I think there's a situation in which I feel we are right now. I think we're going to be okay. I think the ending will be happy. What it may not be is looking like our life before this story started, before the pandemic started. We may not be able to ever go back to the life. I don't know, maybe we will, but maybe we won't. But what will happen, I'm sure, is that we will still be able to find good lives, good reason to go through this. Maybe we will rediscover the outdoors. We will discover other things that we can do while still stay safe from the virus. But I am convinced that if we keep together, there will be a happy ending also to this one.
Well, good. I love that. Some encouragement. People have been very creative these days. All right. Thank you both so much for being here and taking the time to answer our questions.